There are pockets of research and projects that have taken place and continue to take place that use a community health worker model or a peer model, such as the recovery coach, which has become very prominent in the recovery community, the addiction community, and also peer coaches in the serious mental health community, that being able to increase the access to people that are trained, they're also supervised and supported, is something that would be extremely helpful in addressing some of the need. The problem is it's not a billable service. So the insurance companies don't, and our system is as poorly designed as it is, relies on a fee for service model. So that has been a big barrier to increasing that model of care, which we know works.
I am very, very passionate about workforce development in mental health and in healthcare. We are facing a crisis. This is a time of severe urgency. I think it's important for us to reimagine how we can actually start very, very early in young people's development to expose them to careers in behavioral and mental health care. It's important to go as early as kindergarten, middle, elementary, high school, college years, and look at how we can actually bring in training, apprenticeship models to expose them to psychiatry, counseling, social work, neurobiology, places in which they can see themselves in. You can't be what you can't see. And the earlier we start this, the better. There's an innovative program that's actually a really interesting combination of political public sector work with academic institution based in San Francisco at UCSF. The mayor, London Breed, worked with the UCSF faculty to create a program called Change SF, which stands for Community Health Advanced by Next Generation Efforts in San Francisco. This is a really interesting work-based opportunity whereby young people as early as 13 years old to 24 are embedded across different departments at UCSF and the Department of Public Health, and they're getting a chance to get paid. It's important to pay them, right? And they're getting mentorship and educational access that will hopefully they can leverage to a longer-term career in this work. We have to think about experiences and opportunities like that to start very early. And I want to just quickly talk about residencies because I'm an associate program residency director at UCSF. And we know that many, many areas in this country, both in urban and rural areas, have no residency programs where they can train psychiatry workforce. We have to think about ways in which our government and our organization in psychiatry and mental health can come together. Both the ACGME, who are the people that accredit medical programs, so Accreditation Council for Graduate Medical Education, and AAMC, Association of Medical Education, American Medical Colleges, can think about ways to collaborate to expand access with the federal government funding and perhaps grant and philanthropic efforts to embed residency programs in places whereby people don't have access to care. And we have to, really, join in the telehealth phenomenon that we're experiencing and expand our telepsychiatry, telebehavioral health access. I know that we're ending some of our public health emergency from COVID that allowed this to become more expanded. And I'm really nervous about what this will mean if we go backwards and regress towards less access to telepsychiatry. And then lastly, I want to talk about burnout and retention. We are doing really difficult work. Those of us in the mental health workforce are really struggling with the anguish and the pain that comes with caring for a society that is wrangling with so many challenging factors. And we have to ensure that we're actually pouring resources to make sure that we're not losing workforce that we already have. Moral injury is at a high level. We know that people are struggling with finding purpose, with emotional exhaustion in the work that they're doing. So how do we ensure that we're building our provider resiliency with targeted efforts to make sure that we're not losing people in the workforce, because this will actually exacerbate an already really big problem.
Social emotional learning curricula should be mandated from pre-K, preschoolers through college and beyond. I mean, and if you look at the CASEL, the Collaborative for Academic Social Emotional Learning, that puts more people lose their jobs, more people are unemployed, more people, don't succeed in life because they don't make rational decisions, because they don't have empathic skills, because they don't know how to communicate, because they're not inclusive. We need to kind of begin young, as you were saying, Lucy, and educate our students and college students, in social emotional learning. We can train many people. I have fortunately, I was, got a gift that funded outreach workers in Chelsea, Revere, and Charlestown. And we take students right out of college and we train them to actually be coaches. One of ours is embedded in Chelsea in the mental health system, in pediatrics in Charlestown, and in the after school youth zone program in Revere. So they are trainable.